Good afternoon, everyone. We're going to just hold on for just a couple minutes, guys. Give everyone a chance to join in case they're late. All right, we'll go ahead and get going here. So good afternoon, everyone, and welcome to today's roundtable, where we're going to discuss the difficult but impactful topic of mental health in the steel industry. In this industry, we pride ourselves in strength and resilience, but behind that strength, too many are struggling in silence. This roundtable is about breaking that silence, building a culture of support and saving lives. For those of you who are not familiar with us, we are Steel Erectors Association of America, or SEAA, that was established in 1972, and we represent the structural, reinforcing, and steel contractors, fabricators, and suppliers that serve this market. Before we get going on today's webinar, we want to talk about three quick little housekeeping notes for everyone to discuss for the discussion. If you have any questions, they can be typed into the question box. Now that's the icon in the top right-hand corner of your screen, and you can feel free to submit your questions throughout the session. There's no need to hold on to them till the end. We're going to get to as many of them during the time allotted as we can, and we want to follow up with emails with anything that we don't get to today. Number two, we have a recording of this session in place right now, and it'll be available and sent to everyone in 24 hours. If you don't get to that recording or you're trying to send this to someone else, these are always available on SEAA's website under the On Demand tab. So please go and look at the webinars afterwards. There's also an archive of all the other webinars we've done as well. Last but not least, we are very grateful to have Evolution Safety Resources as a partner in this discussion. Julia Kuhnlo and her team bring not only a deep expertise, but a genuine commitment to supporting the men and women in our industry. So with that being said, I'm going to go ahead and introduce our panelists today. So first we have Luke Denton, the Safety Director for ESR. Luke, please tell us why the topic of mental health is so important to you.
Yeah, I started doing some research on this topic a couple of years ago. My wife is a mental health therapist, so I get to see it kind of on a first-hand basis. So, seeing how she interacts in the mental health space versus what I was seeing out in the field as a safety professional kind of spurred that up in me to do my own research and start presenting on the topic, just because it's such an important topic. So that's kind of how I got started.
Thank you, Luke. That's great. We really appreciate your expertise, and I'm sure you're always asking your wife about it as well. So that's cool. We also have Steve Burkholder. He looks like he might be running a few minutes late, but if he joins, I just want to introduce him. He's the president and COO of SNR Enterprises. And just a steel erector in this industry, a board member for SEAA, and someone that'll give us some expertise when he's able to join today. We have Victor Mendez, the safety manager for ESR. Victor, can you give us just a little bit about why this topic of mental health is so important to you?
So for me, the topic of mental health is important because, one, I have lived through it. During my time in service in the Marine Corps, I've dealt with mental health issues, have met people in the construction industry as well as myself, experienced the difficulties of struggling with mental health while in the construction industry and how they take a toll on your everyday life. So I'm passionate about it. I want to try to get as connected to as many people as I can, but obviously I know some people just might not get the message today, but if I can reach at least one person, that's good enough for me.
Amen. Thank you, Victor. I appreciate that. So it looks like Steve is able to join. Steve, I already went ahead and introduced you. If you just have a couple seconds to just tell us why mental health is so important to you.
Oh, well, I'll hit the starting button today. You know, as you're dealing with work and life and everything else. 82-year-old mother took a fall about 35 minutes ago, and you know she's reluctant to call her daughter because she doesn't want to scare her, so she calls me. So fortunately, she's okay. So I apologize for being late to the game and not fully prepared. I had to rush out of my home office, but you know, mental health is important for a lot of reasons. Not just the workplace, your home and life balance. I have 4 children. I have 2 daughters that struggle with it, and you know, when as a parent, you want to protect your children, and you know, mental health is one of the hardest things. And in the state of Pennsylvania, you become an adult at age 14. And at age 14, you have mental health professionals telling people that you don't need to talk to your parents, you don't need to talk to adults, which makes it even more difficult as a parent. But as an employer, you know, the same thing runs down, and people are just afraid to talk. And so that's one of the things I want to hope we get across today is it's okay to talk, it's okay to talk to others, and it's definitely okay to listen.
Thank you, Steve. Appreciate it. With that being said, I'm going to turn it over to Julia Kuhnlo, our moderator for today. She's the president of Evolution Safety Resources. And Julia, I'm sure we'll start out with her why, and then she'll lead us through today. But thank you guys so much for joining Julia and our moderators.
Thanks, Nick, for the kickoff. Hey, everybody. How are you? Can't see any of you, but hopefully y'all can hear us all right. We're excited to be here. As Nick mentioned, you know, this is a super important topic for anybody who was at the annual conference. This is actually a presentation that Luke and I gave while we were there. And for anybody who was in that topic and they saw our very emotional video that we presented, Victor is our employee who had recorded and shared his story with us. We got some great feedback from that presentation, and with that was asked to kind of come and facilitate a little bit more informal roundtable. And so here we are today. What our goals are is to talk very briefly about the statistics around mental health and suicide in the construction industry, and specifically steel, then revisit some of the topics that we discussed when we were in Pittsburgh with regards to how to build a well-rounded mental health program for your companies. The goal here is that everybody can really walk away with some good, tangible ideas that they can take back and get implemented. We're going to talk about some practical tools where we can go online to get free resources, and then ultimately talk about ways to call to action and get everybody's opinions on kind of the biggest things to take away. As we were building this panel, we were really excited about everybody who was willing to participate. You know, Luke comes at it sort of from walking different jobs, specifically in the steel arena, getting to interact with lots of different crews and building up a good, well-rounded understanding, especially from his time at home and his research that he's done independently about mental health in this space. Then we've got Steve, who is leading an organization that's really blazing some trails and some paths with regards to making accommodations for their employees to make it a safe space. And then we've got Victor, who has survived some really hard times and can really give all of us some good insight into what was helpful and what wasn't helpful to him during that window. So as we're going through these topics, what I will say is please, please, please do not hold your questions until the end. I know Nick said that, but the whole idea of a roundtable is that this is supposed to just be a conversation. There is no script, there is no presentation here. It's kind of just prompts to get us talking, yes, but also to get you all talking. And so more so than even just questions, if you have ideas that you want to share, things that you've tried that have been successful, things that you've tried that haven't been successful, this is one of those topics where gatekeeping doesn't do any of us any good. So please collaborate with us and share with us as we go through, and be sure to ask your questions. Okay, so the first thing that we're going to talk about are some key mental health statistics. So really fast, just to kind of get everybody an understanding, this is a huge, huge thing that is facing our industry right now. Approximately 5,500 people a year die by suicide. Those numbers are staggering. So as we talk about the focus 4 in construction, you know, the 4 things that are most likely to kill you on a job: falls, electrical, struck by, caught between. Suicide kills more than all of those things combined. And so as safety professionals, we really have an obligation to treat mental health and suicide prevention as any other risk that we would appear on a job site, if not the biggest risk. Because statistically speaking, if you meet somebody in construction or you meet an iron worker, the biggest risk that they have while on the job are their own hands, suicide. Construction workers are 3.5 times more likely to take their lives than any other trade. And iron workers have the highest suicide rate of any trade within the construction industry. So very specifically here with steel, what we are seeing is that more of our workers are dying by suicide than anything else and than any of their other peers in the space. And so the first question that I did want to bring up to our panelists is, why do you believe that suicide rates are so high for construction in general? And then narrow that down a little bit further. Why do you think we're seeing this so much steel in particular?
Yeah, I'll start us off. So kind of piggybacking off what Julia said, I spent a lot of time in the steel industry space, specifically on data center projects. As everybody knows, that's kind of the big boys in the steel industry right now. They're popping up all over the nation, and they're popping up very fast, and they have very tight schedules. So pressure is on these guys to get in there, work those long hours, throw these buildings up as fast and efficiently as possible. And so, there's crews out there working 6-7 days a week, 10 to 12 hours a day, without any breaks whatsoever. So one aspect is the schedule of some of these projects, where these guys are going from data center to data center, job to job, without hardly any breaks whatsoever, working 70, 80 hours a week. So just the scalability of these jobs and the pace of these jobs sets a lot of fatigue, not only physically for these guys, but mentally as well. So I would say that's a big proponent of it.
Good. What do you think, Victor?
So, piggyback off with Lucas saying, yeah, the long hours, tight schedules, it all falls back to just these guys working these long hours. But something that also can affect them, and why the rates of suicide in construction are so high, is also the substance abuse. Long hours. Some guys won't report injuries, or they won't report that something is aching and hurting, and they'll turn to substance. They'll be drinking, or turn to pain pills or other narcotics. And from my experience, I mean, alcohol was not a good thing. It made my mental health a lot worse than what I thought it was doing.
Yeah, that's such a good point. And the two really are hand in hand. I remember, Luke, there was a slide during our presentation. I can't remember it exactly, but what was it specifically, the statistics just around opioid use in construction? Can you speak to that?
Yeah, so what we didn't show in the statistics, it's not including the substance abuse. So you've got, around 5,500 people in construction dying by suicide, which means they can prove that it was suicide. And you have another 17,000 that are dying from substance use and abuse. And we think that number for suicide is much higher, but because it's substance abuse, if there's not a note or any clear indication that it was on purpose, it doesn't get logged as a suicide. So these numbers are probably on the low side, but to what Victor's point is that these guys are working super long, super hard, and their job is to work and bring money home for their family. So they're not willing to risk missing a week of work. And so how do you do that? You find ways around that. And that can be alcohol, pain pills. And on top of that, again, these guys, this is blue collar work. So there's a lot easier means to lethal means in construction than some of your other industries out there. And that's something else you need to consider.
Yeah, I remember there was a slide that basically outlined all the risk factors, right? Like if you're this, you're at higher risk. And if you're at this, you're at higher risk. And all of them are just a perfect storm of the construction industry, right? If you're isolated from friends and family, if you're working long hours, if you have access and means to drugs and alcohol, goodness gracious, if you're a veteran, right? Like these are all things that we see so much in our industry that it really is like this breeding ground of why these rates are so high. I don't think we have Steve on the line anymore. Maybe we can shoot him a message to make sure. Or Steve, are you with us?
No, I've been here.
Oh, great. Sorry, Steve. I just can't see your face, but it's great to hear your voice.
That's okay. Yeah, I'm here. I just
got it.
turned the camera off.
Perfect.
So
good.
getting back
really
to where I can be more calm. But listen, these two guys hit the nail on the head. But I will add to this that
in the ironwork and steel industry, one of the bigger other stressors is the first step that our people take every morning is vertical. They work in a very highly dangerous work zone. They're working in conditions that, this time of the year in some places of the country, it's still 100 degrees out. In 3 or 4 months, it's going to be 5 or 10 below. And you still have to work, and you have to work if you want to get paid. And if you want to get paid and to send money home to your family, you have to work in conditions that are really hard. One of the guys made the comments about not reporting injuries. And if you ever shook an iron worker's hand that's been doing this a long time, his hands are beat up, his hands are scarred up, their body's broken. It's a tough business, and to survive that, alcohol, substance abuse comes in. It's real easy. And then on top of everything else, unless you are in a city that you're working and going home every night, these guys are booming across the country. They're living in hotels. They're living in campers. They're away from their families for 4, 6, 7, maybe longer weeks at a time. And that's a stressor on life that is very difficult and something that the average person doesn't get to understand. So it is a tough business. It's a rewarding business for sure, but I truly believe that's one of the things that makes it really difficult. And one of the other reasons to be your brother's keeper can really help not just overcome things in life, but the mental health part of it.
Yeah. Oh, and that's such a good segue to the next part that we wanted to talk about here. I mean, I think that the majority of people on this call don't need convincing that this is a topic we need to be addressing, right? Where we're all kind of on the page, the numbers speak for themselves. What you guys all just mentioned I would love to find somebody who would argue with any of those points, right? So we're all on the same page that this is an issue that we need to combat. And then the first question is, where do I start, right? How do I combat it? And so part of the presentation that was given in Pittsburgh was focused upon the pillars of a good mental health program. And basically those pillars are based upon, there's no perfect way to do it. There's no one size fits all, but you need to make sure that your business in some way, in some capacity, is thinking about and addressing each of these areas in order for your program to be a little bit more rock solid. So the items that we addressed was supervisor preparedness and training. So those frontline supervisors who are on the job, making sure that they've received some form of resource or training so that way they can identify risks, identify people who are a little bit off their game, and have some tools to be able to be equipped to starting the conversation. The second is some form of an anonymous reporting system, where if those connections from your frontline supervisors don't feel comfortable for some reason, that employees have another route that they can go to, whether that's a hotline, whether it's a third-party resource, whether it's a direct door to HR, right? Some way that they can get help without having to give their name in case that's a barrier. Employee awareness and communication was pillar number 3, letting employees understand where they can go for support and what to do, steps 1, 2, 3, 4, 5, if they feel that their mental health is suffering. Considerate work practices was our 4th pillar, basically leadership coming up with ideas and routines and practices that help to support the mental health and well-being of their workforce. Access to support services, making sure that those lines are clear and that you have the means and methods to be able to offer support when somebody asks for it. A written program that summarizes all this, right? And then one that's a little bit near and dear to my heart, which is a support after suicide. That statistically speaking, if you have not experienced a suicide at your organization, there's a very good chance you might. And in those times, it's really hard to gather a plan of what to do next. And having that emergency action plan for after a suicide occurs to be able to support your team and your family is super important. So my question to the panel is this: which of these pillars speaks most to you from all of your unique roles and your unique perspectives, because that's why you're here? Which do you think to be the most impactful, and why do you think that? And I'd love to kick off with Victor on this one. Victor, if you're prepared to speak to that first.
So for me, the 2 most that call out to me are the considerate works practices, and I guess it goes hand in hand with the written program, because from my experience, you build a relationship with the guys in the field who you work with, your frontline supervisors. It's almost like they're your brothers, your dads, your uncles, cousins. So you tend to be more open with them than anybody else. And if that frontline supervisor gets and picks up and notices, hey, maybe having 5-10 minutes a day before we even start working of just, hey, how's your weekend? How's your day? How'd you sleep last night? Was that hotel room all right? Man, my hotel room sucked. We had people banging on the door last night, all night, just little conversations like that, a little bit of time to, kind of make it a real true family. And then if the frontline supervisor picks up on those things where it's, okay, this is helping. I noticed the morale's going up. Last week, Joe, he was looking a little sad, a little depressed. Maybe he was starting to scare me, but now because we've been having days of just checking on each other, his mood's improved and his mental health is starting to improve, and we can throw that into the written plans of, hey, this works.
Yeah. What about you, Luke? What do you think?
Yeah, so again, I think these guys in the industry, especially these leaders in the steel industry, they have SSSPs that they have to put on every project, and it's going to cover everything from how they're getting up and tying off on the steel to fatigue management. So, having a well-rounded mental health written program is just as important as the rest of that. So that's why we push having that written program together. But for me, it's kind of a 1-2 combo. So the employee awareness and communication, along with the access to the support. So, over 50% of people who struggle with mental health in construction don't ask for help simply because they don't know where to go. And so an easy barrier to get rid of is give them that awareness. And for us, it's, when you on board with ESR, for example, having that hiring, that new hire orientation, having that 5 minutes of dialogue inside there where you say, hey, this is what our organization believes with mental health. This is the resources that we provide for you. And these are also other means of resources that you can have outside of our organization. So breaking down that barrier to ask for help is one of the easiest things I think you can do, and also one of the most impactful things. So giving them that access to the support, and then just, again, employee awareness and communication could mean bringing in the spouses to talk about our health insurance and say, hey, we cover up to 6 visits with our health insurance. They're free visits for mental health. Ask your employer if that's something that your program has to offer, and having the spouses bought in on it, because they see how their loved ones interact firsthand. So just having them know as well what resources are out there available helps everybody.
And don't tell my spouse; she'll rat me out on everything that goes on in my mind out here at home.
Like, happy you mentioned it. We need those resources. No, but I do. It's you're right. I remember that slide from the presentation where it talked about, it interviewed people and said, you've admitted to struggling. Why did it take you so long to get help? Right. And I think, to your point, it was more than 50. I think it was even around 60% basically said, I didn't know how. And then only second to that was, I was afraid to. And I think it's really easy for us to say, like, the biggest barrier in this dialogue is people not wanting to admit that they need help. But the biggest barrier is them not knowing how to get it. And so I agree, that one is super important. And then we do have a question that just came in that I want to bring up before we ask Steve his answer to this question, which is that as the number of Spanish-speaking workers grows in the industry, many face added stress from language barriers, cultural barriers, and difficulty building trust. Often even exiting mental health systems don't always reach out to them. What strategies do you see as most effective for building trust, inclusion, and safety in this context? And Victor, I'm not trying to pick on you, but I think you can probably offer a really good insight here into some of the cultural barriers and how that impacts the mental health strategy for a different project, if you wouldn't mind taking that question.
No, absolutely. So yeah, it's culturally, mental health in the Hispanic community doesn't exist. We're taught from a very young age, boys are boys. We don't cry. You don't complain. You rub dirt on it and you keep going. But after my personal experience with it, now I go, and when I'm out on job sites, I tell guys, I'm like, hey, you're doing all right. You're doing good. And same thing with ESR. We have our anonymous reporting stickers that we passed out. And I tell them, like, look, this is another way for you to get whatever you have on your chest. Just get it off your chest. Get that weight off your chest. Because a lot of guys don't want, like we said earlier, nobody wants to admit that they have mental health issues. Nobody wants to admit that they're feeling depressed or anxious or that they're having suicidal thoughts, because the second you say, oh, I think I'm getting depressed, it becomes very real. And like we keep saying, if you don't know how to get support, you don't know how to get access to support, it's just a very scary thing, and we get enclosed into it. So with the guys, the language barrier, I mean, it's such a tough thing for these people, because a lot of them do come from foreign countries. Some of them are actually even born here, but their family just growing up spoke nothing but Spanish, so they never learned English. So yeah, I know for firsthand experience, like my parents' mental health, it struggles a lot because of that language barrier. Because right now, with the way, not trying to get into politics, but with the way things are in the country right now, they're terrified of getting pulled over and not being able to communicate with the police and being detained for whatever reason. So yeah, mental health with Hispanics, the Latino community, is very high right now. And I just, every time I go out to the job site, hey, are you guys doing okay? Do you need to talk? If you're too afraid or don't want to talk about it here, we can go sit in my car. We can go away from everybody and have this conversation.
That's awesome, Victor. Thank you. And I think you're right. You hit a good one that, the resources we give out and the stickers that we hand out, always make sure we have them available in multiple languages. So that way it doesn't seem like we're trying to not include somebody in our efforts. But I think another huge thing is also, as we talk about this supervisor preparedness training, right? Like having our leadership be able to respond in these emergencies. I think if your leaders aren't bilingual, taking a look at the bilingual members of your crews and also offering that training to leaders within that space as well. So that way you do have people who are trained and equipped to be able to handle these questions and provide these resources in multiple languages on every crew, right? So when we talk about the supervisor preparedness, that doesn't just mean the super on each site, right? That means making sure that all languages that are being spoken on your site have access to somebody who has received training on how to start the conversation and how to provide help in the right way, right? I think that's another thing that we could offer as well.
Yeah.
That's a great question. Thank you for asking questions. It makes me so happy that we're not saving them until the end. Steve, I want to pass the microphone to you since you didn't have the opportunity to answer this question yet. As we look at these pillars, which is the one that you really think is most important from your position, as a leader of such a big company in the space?
Yeah, identifiably is number one, and that's your preparedness. All the rest, I think you can roll back into that. But the biggest one is creating a culture of safe. Creating a culture of comfortability, if that's the right word. But one of the things that since day one at SNR is our number one customer is our employees. It is truly put before the word profit. I don't like to recognize the word profit by its definition. Profit is when our people go home happy, when their families are happy, their families are proud, and their families are flourishing. That's true profit. And when you spend the time and the money and the effort in putting it into your employees, not just in training them physically on how to do the ironwork, but training them on how to be a better person, speaking and being a better person yourself. As leaders, you have to be leader of men in this industry, leader of good people. But by being a good person, by waking up every day and knowing that your first task needs to be that good person and taking care of your people, taking care of your brother and your sisters, and making sure that they're protected and making sure that they understand the importance of going home and family. And again, I could talk for this on hours. We have 350 some family members spread across the country and the Caribbean right now. And when I say that, that's not just jargon. That's really mean for that. Whether it's a fire watch that I've never met, my door's always open. The leadership's always open. And the biggest thing is getting your people to understand. We mentioned this several times. It's okay to talk. it's okay to ask for help. This younger generation, the hardest thing they know how to do is ask for help. And so by creating a culture that they feel safe in will get you a long way to this where you want to be.
And Steve, we just had another question come in that I would love to direct to you. And that question is, what would an ideal employee assistance program look like for our industry? I didn't know if you have something in practice at your organization or that you've heard some of your other peers talk about that maybe you could recommend here in terms of a really strong EAP for somebody in steel.
I think it starts back because it's so difficult to put things in writing when and I'm not a policy, but when you put them in writing, to follow them. That's one thing I'm old school. But to put something in place that is dedicated to pouring the energy that they need, no matter what the situation be. So, for instance, we might be working in the Caribbean, and somebody has an issue in the Caribbean at home, and you're not worried about, oh, well, you got to pay me back to get home because your daughter's sick. It's taking the action and getting them to understand that they are truly number one. And so, having a written program like that, I'll be full disclosure, SNR doesn't necessarily have the strongest written program, but I promise you it is well known that if you have a family member that's in trouble and you're 1,600 miles away, there's no question that the job is now not first. The job becomes way down the line. And I said, so I think getting that commitment to your people, and then you can let the policy writers write the program, but as a leader, protect your people and be there for them. Don't worry about the damn money. The money will be returned to you tenfold if you take care of them. So I hope that answers that.
100%. Yeah, and I will just kind of open it up to Luke and Victor. We can all kind of spitball some things that we've seen just from our opportunities to bounce around. From my perspective, I think a good EAP is certainly going to include some provisions for therapy. What we do need to consider is that either offering that virtually or in person. Our crews are on the road so much that saying, yeah, you can go see a therapist can be really hard to schedule that appointment if you're then on the road the next week, right? So making sure that those therapy have virtual means as well as in-person means is really important for an EAP in construction. I think that it's also important to include some substance abuse provisions within this mental health EAP, right? Where to go if you need support, if you ask for help, the rights that are granted to you, how much time you can take off with your position still being protected if you come to help ahead of time and say that you need support, right? I also think the strongest EAPs that I see automatically apply, to Steve's point, to family, because you cannot expect a worker to have their head in the game if their wife or their child is struggling, right? And so as an employer, you have access to these resources. Offering them out beyond just your workers, but to your workers and their families is something that can really make that EAP strong and meaningful and that much more impactful and getting everybody's head clear before they step on the job. Provisions for bereavement leave, things like that. Those are all really good things to include. Luke, Victor, what am I missing? What did me and Steve miss? I know we're kind of just spitballing here for this question, but it's a great question.
So yeah, I like both of you kind of hit on it, but there's so many different avenues and paths you can go down that you can, as an organization, attach yourself to a mental health organization like BetterHelp, and you can have that as a feature. And basically BetterHelp is online therapy, and it's relatively affordable. So it could be something as saying, hey, like, our insurance doesn't cover this, but this is part of your employee benefits here, is that we will pay for X amount of therapy with no cost to you. And here's your BetterHelp QR code. You scan that, they'll find you a therapist. Again, there's a lot of different ways you can do it. It can come through the health insurance, but it doesn't always have to.
That's a good point.
Yeah, and to what Luke was saying, like, if the companies offer some stuff, offer some help like that, I know that's definitely one of the things that, for me, that was an issue, was that I knew where to get the help from sometimes, like some of the sources, but I didn't have the time because of work, or I just couldn't find the money to pay for this these sessions, or insurance wouldn't cover it. So that, I think that's one of the issues too that some people face, is that they can't afford it. They don't know how to access it, or if they do, they don't have time for it. I think that's one of the good ones.
Yeah, and back to Steve's points, like if you can show your employees that you care, to what Steve said, like that's going to pay for itself tenfold. You're going to get that loyalty where you're not having that high turnover, because they want to work for an organization that they feel like cares for them. There's a lot of guys that are going to hop around and chase that dollar, but if you can prove that, hey, we mean what we say, and we're here for you, your family, you're going to retain a lot more employees, and it's going to cut down costs on turnover and retraining and everything else. Like there's just so many added benefits that you might not think about just by providing mental health resources.
And from an ownership level, just one last thing is when you are looking at your healthcare program, ask the questions of what's included. We do that every year.
Half the time they don't advertise it. You're 100% right. It's not included in the benefits package, but if you ask about it, it is included in your plan, but you have to ask.
Very deep.
Yep. Yeah, that's a really good point. Because it's true. I thought that for our company at ESR that we didn't have it. We were paying out of pocket, went and just asked the question, oh yeah, we offer that. Did we forget to put that in your packet? Kind of digging around and asking what your rights are is helpful there. Good point, Steve. All right. So that brings us to our next question. What we've really spent a lot of time talking about is culture, right? And creating a culture where everybody feels that they can talk, where they understand it's an open door policy. And really what this next pillar about, and what this next question is about, is specifically around communication and awareness. How do you keep mental health at the forefront of everybody's mind? This is not a topic that you tell them about in new hire orientation and then don't revisit until there's a problem, right? We need to be revisiting the hazards associated with our work just as routinely as we revisit the hazards associated with our work in terms of fall protection and electricity, right? And so this one is about, how do we keep it front of mind? How do we make sure that this is a topic that doesn't get stale or get forgotten in all the work that we're managing? And some ideas here that we've seen other companies use and get good success on is including mental health in their toolbox talk rotation, having email blasts from HR or for leadership about the importance of mental health and reminders about resources available, signage on job sites, training, new hire orientations, hard hat stickers, peer support groups, right? These are all those things that we say, it doesn't matter what you do, but you got to do something, right? Somehow you need to make sure that this is a topic that doesn't get forgotten until it's September and it's Suicide Awareness Month, right? And so I want to open it up, and Steve, let's talk with you on this one first, if you don't mind. How do you recommend reaching those who might need support? And once you've kind of got the guts to reach them, how do you start that conversation?
Or is it my turn?
That's for you, sir.
I'm on. Yeah, I think it goes back to another word that we use a lot besides family and culture. And our number one is simple. And it's a simple, most powerful thing in life: communicate. Every day, we talk about on the back toolbox talks. Get our safety director sending emails out about this topic. It can be just on a Tuesday. It doesn't have to be on a Monday morning's topic. You got your toolbox talks. One of the things that we do every week is we talk about fall protection. Well, one of the other things we talk about is mental health and feeling safe. The job site signage, a lot of GCs do a good job, but take theirs, what they do, and accentuate it. Hey guys, listen, we were on a job site, a data center in Fayetteville, Georgia, and they had mental health advisors come out. They had stretch people, I can't say that word, kinesiologists come out.
Yeah.
And guys, someone mentioned it earlier, iron workers are these big, rough, tough guys. They're not going to go over there and, do yoga. But then they find out when they're doing it behind the corner, behind the food truck, and they're like, wow, this stuff really works. I felt better when I did it.
Yeah.
The hard hat stickers, all of the things that are there tie back into one solid word: communication, from the top to the bottom, and allow the communication to flow back uphill. Allow the fire watch who's making $20 an hour, that's standing out there all day long, like the flagger along the road, that you think, oh my God, that job must be make them feel important. And then make them understand they're probably your best eyes on the job because they stand there all day and watch. They can see the attitudes. They can see the different things. Talk to every level of your leadership team. Talk to every person on your team. This topic on the right-hand side of this slide starts with the word communication. That's there for a reason. And entrust it and know that it's also not going to be easy. It is not easy to have Jimmy walk in and say, my puppy died and I need to go home. Well, what is the value to that to him? A whole lot, maybe more to him than you. So what does it make? Why are you any better of a person that you're not upset because of that? He is. Don't let that sway your decision. Don't allow production. Don't allow all those other things that we just talked about get away from the fact that that person that's talking to you is a human being. Understand that. I use the word a lot when I hang up with my guys, love and respect, man. And I mean it. But communicate with them. Ask them how they're doing. I think Luke or Victor made a comment earlier. Ask them how they're doing, man. Hey, Monday morning, how's your team look horrible. Don't just make it garbage talk. Mean it. Take the time. One of the things that I have written down, and I write action items out all day long, every day, is to communicate with my team. And if that may not necessarily mean I'm going to call 350 people, or maybe an email, I may walk in the office and I spend more time walking around my office, chewing on the fat, asking how things are, how the kids, how are things going, blah, 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 before we even talk about work. Work's not everything. Your people are.
That's awesome, Steve. And you hit a really good point about halfway through that. And I wanted to pass the mic to Luke on it, because I know, Luke, this is something you're passionate about, that having the conversation and having the guts to ask the question can be maybe a little bit intimidating, right? And we don't know where to start. And so because we're afraid to start, we don't. Luke, you had a script that I remember you presented that, one, I want to hear your answer to this question. But can you start off just with a quick reminder of, for somebody who is looking to communicate, and is looking to bridge the gap that Steve just talked about, what does that conversation sound like?
Yeah, so it's just like anything else. Is you need to prepare for having these tough conversations. It's just like practicing for anything else. I hope you never have to, but if the time arises and you need it, then it's good to already have this in your back pocket. But essentially, it's calling out the behavior that you're seeing, whether that's, hey, Victor, you've missed 4 or 5 days in the last 2 weeks at work. Like, what's going on with you at home? Showing them that you see them and that you're noticing things, and then that's how you start the conversation. And then once they open up that conversation, that next step is saying, hey, I hear what you're going through. What you're dealing with right now, I can understand if you're thinking about suicide. A lot of the times people think that they shouldn't say suicide, that's a taboo word, that if I say it, it's going to make things worse. That's not the case. Most of the time, people who are having these thoughts are stuck in a negative feedback loop all day inside their own head. So you calling that out, saying, hey, I hear what you're going through. It would make sense if suicide was something you were considering. And then that third part to tie it all together is just telling them that, hey, what you're talking about is extremely difficult, and I appreciate your willingness, your vulnerability to do that. And I'm not going anywhere. I'm here for you, and let's go get you some help. And again, we don't expect anybody to be mental health professionals. That's not our jobs out there. We're safety professionals. We're leaders of companies. But what you can do is say, hey, we can get you the help that you need. So staying with them through that, not just, to Victor's point, not just saying, hey, how you been? And then not talk to them again. Like, call it out, say the word suicide, and then at the very end, attach it all together and say, I appreciate your willingness to bring this up, because people don't want to talk about it. It's a hard thing to talk about. And so if you have that person willing to do that, it's important, it's imperative that you acknowledge how difficult it is for them to do it and just be thankful that they did.
Victor, when we were kind of talking about this topic originally and you offered to be on the panel, you had said that one of the things that you wanted to discuss was, you know, when you were in a tough spot, ways that people talked to you that were helpful and ways that people offered support that weren't helpful. And I think that that would be really good insight if you're willing to share here about, you know, when someone is kind of in that negative headspace, what approach and what communication techniques really land and which ones weren't as effective for you, because it's a little different for everybody, right?
Right. So like you said, it's different for everybody. Some people are just willing to just, as soon as they get a listening ear, they'll pour it all out. But some people like me, it was very difficult for me to have that conversation, to actually start opening up about my mental health. So what actually worked out best for me was when, and I always say it's Guy Raymond, he's our safety director now at ESR, but he was the one that came up to the job site, and he sat with me in the car, and it wasn't rushed. It wasn't him just, hey man, I need you to go, just tell me what's wrong so I can get back to the office. I mean, we sat there for maybe 2-3 hours, and he let me go at my own pace. It wasn't rushed. I didn't feel rushed. I didn't feel like I was inconveniencing him by pouring everything out on him. But yeah, and then just other things that never really helped out was just the, hey man, I got you. I'm here for you. You ever need anything, just let me know. Because it's just that little phrase, and then poof, they're gone. When you go out there and, hey man, I got to talk to you about something. You got some time? No, man, I'm really busy right now. I can't really talk. Okay. So then after that, you just prove that you don't really got me, and not going to be sit there and willing to listen to me talk about what's going on with me. But actually taking the time, listening to them, what they have to say, and definitely no judgment. Because what might not feel as difficult for, say, for example, Julia, if I tell her, hey, I dropped my Gatorade bottle on the floor, and it's Julia could be thinking, that's nothing. I drop my water bottle every day. But for me, that might mean something, and that could be the tip of the iceberg of what else is going on in my mind.
Yeah, that kind of relates back to Steve's puppy analogy, right? Like, it's not about how it feels to you. It's about trying to empathize when somebody tells it how it feels to them, right? I remember, first of all, Victor, thank you for talking to us about that.
Yeah.
I remember the first time you told me, really, my biggest takeaway, what you said helped you out, was someone who was almost a little bit more assertive in offering their support, right? Like, hey man, let me know what you need. I'm here if you need me. Puts the ball in the person's court to ask for help, seek help, right? Like it's another thing on their list, which maybe already feels overwhelming, as opposed to like, dude, come here for a sec. I just want to talk to you. Let's go catch up, right? And like, you create that space and you create that time, and you can get more aggressive and assertive and allowing that person the space. I remember thinking that was something about your story that I hadn't thought about from that angle, but of course I would think that would probably make a difference to a lot of people.
Yeah. And I mean, like I say, Guy, he was probably my biggest support during that time, because I mean, he sat me down, we talked. He was, he would see me start to break down, and hey, just take your breath. Once you can catch your breath, let's talk. And then after everything was said and done, he was like, here's some resources for you. Here's what I'm gonna do with the company we were at, so we can support guys like you, people that, because we never knew who had anything going on, if anybody even had mental health issues, until it was me that happened to go through it. And it was like, okay, we need to change our EAP to include mental health.
Yeah. It's amazing, isn't it? I remember Luke and I felt the same way after the presentation in Pittsburgh, that like, you start the dialogue, it takes someone to start the dialogue, and then it's almost overwhelming, the amount of people who were just waiting for somebody to open up the door so they could start talking, right? Like after Pittsburgh, I feel like we must have had 20, 30 people come up to the stage wanting to share, right? Like they've just been, and then even at the happy hour afterwards, people are coming up, they want to share and they want to talk, and they're just waiting for someone to create the space, not tell them
Yeah.
that they're here when they want it, right? But to create the space and create the
Right.
opportunity. Yeah.
Yep.
All right. We are almost out of time. This has been a really great conversation, but our last question quickly is, if you guys could kind of give one call to action from your seats about what you would hope everybody on this webinar would take with them, what would you advocate for and why? And Victor, I would love to start with you on this one, that, you know, one thing that you wish you could really make an impact on and hope that somebody takes away from. What do you hope they take from this topic, from this session today?
Just be prepared to offer the help. Just like everybody said, the communication has to be there. But like Luke says, it is a difficult conversation to start, or it's a difficult conversation to even want to listen, because some people are there like, I really don't want to hear your problems. You know, the whole subject about mental health and suicide is, So just be prepared to have that conversation with somebody. Be prepared to offer the help. You know, not just, hey, I got you. Actually, hey man, I got you.
Yeah.
Here's some resources that I know of that we can help you out. You know, or hey, I know the office, you know, ESR, they offer therapy sessions that are covered in our insurance. Do you want me to try to get you the phone number for that, or find you a place where we can take you so you can get some therapy, some help? You know, be prepared for that sort of thing, because it's not always just a, hey man, I got you, you'll be all right, and then just let it be.
Yeah. What about you, Steve? If you could advocate for one big takeaway, what would you hope people would take away from this conversation?
Understand this big, tough world of being in construction. It's okay to be vulnerable. It's okay to open yourself up, and it's okay to let other people see your vulnerabilities. It's okay. It's safe. And then create that culture so that your people see that. You know, it's okay. If folks that know me, I don't have a problem being emotional out in public. Wear your heart on your sleeve. Take care of your people. And working hard on your people is just as important than working hard on a job. You can hang 85 pieces a day and you think you're killing it. But if your team is miserable and they're going to walk away, or they're going to quit this business, or they're going to not do well or be well, and their families are going to suffer, then you didn't win. So work hard on your people and open your hearts to them. That's the biggest advice I could give.
What about you, Nick?
Yeah.
What would your big takeaway be?
For me, it's kind of a combination of a couple of these call to action. So one, you know, remembering the risk factors. Just as soon as you step on the job site, understand the risk factors that are prevalent on that job site from a mental health standpoint. To Julia's earlier point in the very beginning, you know, we look for the things that can kill you on the job site all the time, whether it be falls or struck bys. But, you know the risk factors when it comes to mental health, what these guys are dealing with on a day-to-day basis. And then again, knowing the warning signs. Are they showing up late for work? Are they being aggressive to other employees where they normally a happy-go-lucky guy? Something that we don't talk about, and I don't know if there's any other safety professionals in this chat today, but whenever there's an incident on site, we as a safety professional want to get to the root cause as fast as possible and get a solution and keep moving forward. But having an incident, having a near miss could be a warning sign. You've got that forklift operator who's been operating for 10, 15 years on that thing, and he's never had an incident. And all of a sudden he's had 3 of them in the last couple of weeks. He didn't forget how to operate that lull. So there might be something going on different. His mind's not on the task. So taking that step just a little bit deeper, saying, hey, what is there something else other than, this was just a random incident and we're trying to find a root cause. Look, know those warning signs up front, remember the risk and know those warning signs. And then to Victor's point, be prepared to have those tough conversations.
Awesome.
Hey, Julia.
Yeah, Nick.
Sorry, I just wanted to jump into with the take care of yourself one, because that's just me. you really, as a leader in an organization, you have to take care of yourself because people are watching, you know, what you're doing, and you want to build trust with them, like Steve's saying, and Luke and Victor. You have to build that trust with your people. And if you're, you know, if they tell you something and you're not keeping that to yourself and you're spreading rumors, you're doing those types of things, then you're not a person that they can trust. So just that one thing about taking care of yourself, and just people do what you do. They don't do what you say. So if you're going to be a leader in these organizations, you know, that's just something that you got to be approachable. But you also have to just be, you know, you have to take care of yourself too. So that one really called out to me.
Mm.
Kind of that old adage when you're, you know, you ever ridden on a plane, it's oxygen mask, put yours on first. You're not going to do anybody any good if you don't have a good mental health yourself. You can't help anybody else if you're also struggling. So to his point, take care of yourself. And in construction, that's super hard to do, but try to get 8 hours of sleep if you can. Try to eat healthy. Like, just put the action steps forward. You don't have to be perfect, but just try. You know, instead of now we're getting 4 hours of sleep, I'm getting 5. Like, that is an improvement. You know, instead of eating at the food truck, I've brought my own, and it's, you know, a healthier option. Like, take care of yourself with small steps, and then that just lets you help more people as well.
We do have a couple of questions that are still coming in, and I don't know that we're going to have time to get to everything. I'm so grateful that everybody's putting their things in the conversation, but I did just want to mention before we switch the mic back to Nick, that there are a lot of free resources available online. Note the word free, right? Like, the research is out there, the resources are out there. These are things that you can do and coordinate that we've tested on our side, that you can get. So one of the best things you can do, you can go to the 988 website, and you can order wallet cards and hard hat stickers and bumper stickers and posters, right? We talk about job site signage, all of these communication tools. You don't have to create that from scratch. You can use ChatGPT, or you can order them for free. I think we got 40 job site posters for free. They just ship them out. Like, they want to provide these resources, right? 988 is a great place to go. The Construction Safety Hotline is a great place to go, another great website. There's some free quizzes that you can take online and pass out to your team, which are really exciting. And then we've kind of put together, to Luke's point, when at ESR, when we do a new hire, part of our welcome to the team is, here's a list of things that we offer as a company, and then here's a list of third-party sources if you need them, right? And so we've got a one-pager that says, if you're struggling with this, contact these people. If you're struggling with this, contact these people. And we're happy to share that. Just drop your information in the chat and we can send it out to you. You just hit print on it, 3-hole punch it, and include it in your employee binder, right? This stuff isn't designed to be a huge lift for you to create something from scratch. The resources are out there. And again, there's no gatekeeping in this topic. Nobody wins when we do that. So please utilize the free resources that are available online, and we're willing to share. Just drop your name in and we'll send you what we've got. But with that, with a beautiful 2 minutes, Nick, sorry I left you no time at the finish line. But that is what our panelists were prepared to speak with today, but are certainly open and ready and excited to talk to anybody else who might have a question, or honestly hear from somebody who has a story to share would be wonderful as well.
Yeah, thank you so much, Julia. Yeah, we really appreciate Julia, you and your team here, and just Steve, Victor, Luke. We just can't thank you guys enough for your time being panelists today. If there's any questions, I think we will, since we are at the hour, we will try to follow up with those after today. But just to give you guys a little bit of insight, one way, you know, I think that helps my mental health is connecting with people. So we do have events that Steel Erectors is a great organization for connecting with people. And our next event coming up is the David Schultz Memorial Golf Tournament. That's October 17th. And you can sign up to participate in that. There's also a meet and greet the night before on October 16th. So come on out and join us in Raleigh, North Carolina. Again, it's helpful for all of our mental health to be able to share our stories and get together. This webinar is a great start, but then in person is even better. Then the next thing, just to let you guys know, we have the convention and trade show dates on May 5th through May 8th on 2026. So put those on your calendar because that's the next trade show. SEAA's coming to the Midwest, and we just want a great turnout there. And then we also have a director of membership, William. If you see his email in there, he's new to the team. So if you get a chance to see him in Raleigh, it'll be a perfect opportunity to welcome him to the SEAA team. And last but not least, if you have any webinars, please reach out to SEAA leadership, reach out to myself as well, I lead the webinars for SEAA. So if you guys have any ideas that you want to share, we would love to have you. But with all that being said, again, thank you guys so much for joining, and thank you, Julia, Victor, Luke, and Steve. This has been a great, memorable experience, and I'm sure it'll be used multiple times in the future. So everyone, have a blessed week, okay?
Thank you.
Thanks, guys.
Nick.